welcome back. And the second part of our conversation is looking at efforts to be able to address the cervical cancer situation in Belize. And we have with us a representative of the Ministry of Health, the Maternal and Child Health Coordinator, Dr. Natalia, and Dr. Cynthia Terry, who's the Medical Director at the Belize Family Life Association. Good morning and welcome.
Good morning.
Good morning.
Now, let's start off with an overview as to the situation of cervical cancer in Belize. And we can go ahead and talk about latest statistics, no?
Yeah. We have a National Cervical Cancer Committee. Both of us sit on the committee, so we are working closely. The VIA started with BFLA, and then now we are rolling it out through the Ministry of Health. We still need to train more doctors and nurses to cover the entire country. The latest statistic that we have is about 30 plus cases of cervical cancer being diagnosed per year. And when we look at the mortality data, we have about 8 to 12 deaths per year due to cervical cancer. Now, the evidence is telling us that, and we noticed a few years ago that there should be no death due to cervical cancer because of the time frame from the start of the cancer until it causes death. So there is an opportunity, hence the reason to change the strategy that we have in place. We were only focusing on Pap Smear, but the turnaround time is an issue, especially with staffing issue that we have. And many women last to follow up, so hence the reason to invest in visual inspection with acetic acid.
Now, there are interesting facts about cervical cancer that I wanted to get out. One, there are parts of this world that cervical cancer is not a concern for them whatsoever, because they have been able to effectively address the situation of the HPV virus. We have spoken about, you said that it is unnecessary for women to die from this disease. And that's because cervical cancer is preventable and treatable. So can I ask, why is it that we still see as many as 30 new cases and 12 deaths, almost half of the women who are diagnosed, dying yearly?
Yes. Well, it's a complex situation when you look at cervical cancer. HPV is an infection that the body can take care of it in early ages, teens and 20s. But after the woman reaches 30s and she still have HPV, the problem with HPV is the persistence of the infection that leads to cancer. So it's not easy. We are not offering the tests as a public good yet. It's there available in private sector, but the cost is pretty high. We are working on that to bring it in, but we need to do some more work there.
And I
to
guess
access the test.
And I guess too, Doc, part of that mortality has to do with not linking screening with treatment. Many times women are screened. You could get screened by the best test available in the world, but if you only get screened and that's where the buck stops, then no impact is made on cervical cancer. So by introducing visual inspection with acetic acid, which is what VIA stands for, and actually linking it with cryotherapy, it becomes like a one-stop shop. So the woman gets screened, and if there is something positive, she has that power to choose if she wants to get treated right away. And not only cryotherapy, but also now we've introduced LEAP, which is a loop electrical excision therapy, a procedure, and it involves the treatment of these lesions that were not eligible for cryotherapy previously. So in the beginning, we would go on these screening campaigns and have these screening clinics where women would get screened and we find them positive, but their lesions might have been too large and not eligible for cryotherapy, so they were not able to get the treatment. But now, since we've expanded into having LEAP, this new treatment, these women can actually get treated also. So we did a training in May, and so many providers were trained. Those who already had the skill were actually just standardized in the way that we would offer the service. And so the service is actually available at Ministry of Health facilities, a couple of them, Dr. Beer can explain, and we also have it available at BFLA. So I think it will have a big impact too on the mortality, a direct impact on the mortality, and apart from that, the ministry is also doing some HPV vaccines, and we should see the effect of that probably in the next 15 or 20 years. So I think that would be
What is the level of public awareness insofar as cervical cancer? I know that perhaps there is a number of women out there who may not necessarily be as knowledgeable as they should be about cervical cancer and the fact that it's treatable, and the fact that, as Marlene mentioned earlier, almost 50% of those who are diagnosed on an annual basis are dying of cervical cancer.
It's just a reflection of the consequences of early sexual initiation of sexual activity, the lack of use of condom. Remember, cervical cancer is caused by HPV, and HPV is transmitted sexually. Other risk factors are alcohol, the use of tobacco. So yes, we agree, information is needed. I know the district cancer societies are heavily promoting the services. So it's a matter of individual responsibility. I mean, every woman should make sure that she have her Pap smear done now. From 30 to 25 to 49 years, they can access the VIA with treatment if needed.
So it replaces the Pap smear. That's what the VIA test does.
It complements, because 25 to 49 VIA. But even within that age group, if there is a problem looking or seeing the transformation zone, then those women would have to be screened with Pap smear. Outside of that age group, then is Pap smear. So it's not eliminating Pap smear. It's complementing. And the purpose of the VIA is to increase access to the screening, and as Dr. was explaining, access to treatment.
So how does this work, if you don't mind me asking?
Okay, so as we mentioned, VIA stands for Visual Inspection with Acetic Acid. So acetic acid is just a fancy word for vinegar. So we actually use the Grace vinegar that they sell. We're not promoting Grace, but that's what we use, because we use a 5%, 3 to 5% solution. So the woman gets in that same gynecological position that we don't really like. So when the cervix is visualized, a little wash is done with the acetic acid solution, and areas that have abnormal cells will turn white. So very simple. That's why the name aceto-white lesions. And it turns white not because of anything out of this world. It's just that abnormal cells tend to have a lot more protein. So because of the nuclear activity and high metabolism in it. So these proteins, when they interact with the acetic acid, then it precipitates the protein, and so light is unable to pass through the tissue as much as it would in a normal cell. So hence that little white cloudy look. And so providers are trained to recognize these abnormal looking regions of the cervix, and that's what we would call a positive lesion.
Now, that would be your inspection test. So it recognizes abnormal cells. But what VIA does, from what you've explained, is that it's screening and treating. So where does the treatment part come in?
So when a woman so there's a big counseling that happens before we actually get into the whole procedure. So the woman is explained what we're going to do and what are the possibilities of the results. And so if she gets a positive result, then the second phase comes in. So by this time she would have been counseled a little bit on what cryotherapy is. And so we would then proceed to apply a tip. We use a cryotherapy gun, and it's linked to a compressed gas. In this case we use carbon dioxide gas, and the little tip is applied right to the mouth of the cervix, and it is frozen. So we freeze for about 3 minutes, and then we thaw for 5 minutes, and then we freeze for 3 minutes. What the freezing does, it's an ablative therapy, so it causes cell destruction because it freezes the liquids in the cell, and it also causes stasis of the blood vessels. So there's a necrosis that happens because the tissue is unable to feed itself with the blood vessels. So two things happen, and that's what causes destruction of the cell. And we would expect this to have a cure rate of almost over 90%.
Wow.
So we normally ask the woman to come back within a year time, and then we would rescreen back again. Of course, this is a little bit more difficult in women with HIV because of the immune system, and so their cure rates might be a little bit lower. So we encourage women not only to get a Pap smear done or get a VIA done, but also know your HIV status, because it really influences how your body fights HPV. Women with HIV have higher incidences of HPV infection, sometimes multiple HPV subtypes infection, and they have a higher risk for developing larger lesions that are more difficult to treat.
Because their immune system is compromised by the
they
HIV.
need to be screened yearly.
Right.
Now, so you are able to, you have been rolling out this program through the BFLA for some time. Now there's a partnership with Ministry of Health. Can I ask you, what has been the success rate in terms of being able to get women to agree to treatment when they take the VIA test? Because what I'm hearing from you is that ultimately you do the VIA test and screen for abnormal cells, but there has to be a consent that if something is found, that you will be allowed to treat. How often are women willing to be able to do both?
Okay, so very good question. With the proper education and counseling, even before the woman gets on the table, the woman is already mentally prepared, and she already decides whether she would want to go ahead with the treatment or not.
Okay.
In the urban settings, our what we call a single visit approach rate is almost 100%, meaning that the woman who has a lesion decides that she wants a treatment right away. So our success is almost 100%. When it comes to the more rural settings, like when we go on campaigns, it might be a little bit lower because women, a little bit more, I don't want to say traditional, but they would have to get the consent of their partners or their husbands, or they'll tell you, you know what, I'll come back tomorrow. Or so it's a little bit lower. So what we've found is that sometimes in rural settings, it's good to do like a pre-education of the population before you actually go in to provide the service. Then that way, even the spouses or the families are aware of it, and it would improve the single visit approach.
So what you're able to do in one day with this test would have been over the course of at minimum a week or two. Had you done a Pap smear, go back for results?
Months.
Really?
Or months.
And that is because you also had a problem that some women don't go back for the results from their Pap smear.
That's correct.
So a treatment that would have taken months can be done in one day.
In one day.
Is it more expensive for people to be able to access this treatment, or will it be administered free of cost?
Well, they have a cost at BFLA, $35, but with the ministry,
how much is it?
$35.
$45.
$45
for the treatment.
No,
With or without treatment.
so we call it a screen and treat package. So you come in, you screen, you pay $45. If you didn't need treatment, great. But if you need treatment, then that's included. And it's done that way so that we don't turn back women like, okay, you get screened, you're positive. Oh, but you don't have that additional $60. So we do one single thing, and it works out well because the negatives end up paying for the positives, right?
In the ministry, well, it's free of cost.
Okay.
Well, I want to say free of cost, but no direct payment.
You don't have to pay for it.
The government pay for it.
Yeah.
I must pick up the government of Belize because we procured the cryotherapy units, we procured the LEAP units, and we invested in the training.
Yeah. So let's talk about this rollout through the Ministry of Health. As I mentioned before, BFLA has been doing this for some time. I think we had a
2014.
conversation about it last year. So what will happen now that the Ministry of Health is now partnering to be able to roll out this test?
Well, we started with the training for Orange Walk, Belmopang, Belize City, and Punta Gorda.
Yeah.
We're hoping to have, by the end of the year, the other districts covered. And then from there, we definitely need to review the strategies that we will be using to provide the service. We can't just sit and wait at the clinic. I was talking with Dr. Rod that we need to start planning. Once we have all the districts trained, we need to start planning campaigns to carry the services closer to home. The units that we have are portable, so it allows for they see and they screen and treat on site.
Yeah. Now, we have seen a targeted effort at addressing cervical cancer in this country, from what is now the VIA test to the HPV vaccine. Dr. Beer, as part of the Maternal and Child Health Program in the Ministry of Health, why is this such an important issue for us in Belize?
Well, as we said at the beginning, I mean, no woman should die of cervical cancer. And what was in place is definitely not curving the numbers down. So we needed to invest in the vaccines and then look for a strategy where the woman can access treatment quickly the same day, which is offered through the VIA and cryotherapy.
And very quickly, will there be another rollout of the HPV vaccines this upcoming school year as well?
Every year.
It's
part of the national vaccination schedule. So every year we expect to provide the vaccine to girls in standard 4 class.
And how have we been doing in terms of parental consent for that?
Pretty high. We have a few schools that are giving us problem, but it's the education staff that is not allowing us to enter the school.
Okay.
But once we have the communication with the parents, the acceptance rate is pretty high. So for those schools that we could not access the girls there in the school, then they can access the services at the health center. But the acceptance rate is pretty high. Right. We had 58.8% coverage.
Nice.
For an introduction, it's not bad. 3 districts had more than 70% coverage. 3 of them had low coverage. So we expect to improve that with this new cycle. So it's every year.
Yeah.
We provide the vaccines November and then May to get the girl in the same school year.
Yeah. And let's talk to women about when to screen or when and where to go for a VIA test, right?
When 25 to 49 is what we're promoting.
Okay.
Services are available at BFLA, walking any day, and promoting BFLA.
Yeah.
With the Ministry of Health, we have one day set up by each one of the facilities, so women would need to find out what day exactly. I know Belmopang is every Thursday. But because of the amount of women that may need testing, then they would have to request appointment. But it's a package, as Dr. was mentioning, screen and treatment right there if you need it.
So contact your nearest public health clinic, find out when it will be offered, make your appointment.
And
it's free through the Ministry of Health.
The only contraindication is being pregnant.
Right, if you're pregnant.
Nothing else.
So in Belize City, there's a Belize Family Life headquarters, the NHI Clinic, Matron Roberts Health Center, Cleopatra White Health Center are offering the services in Belize City, and in San Pedro Polyclinic. So it's good.
All right, so we really hope people take advantage of that. We want to thank you for coming in and telling us about it. Anything else in the pipeline that you'd like to share with us? Probably when you'll move down south, for example?
We'll come back when we have the campaign plans.
And from BFLA part, we're looking into probably getting HPV tests, which would be a great thing for all of us. So we might actually have to do a VIA. Only women that actually test positive for HPV would have to do a VIA or a follow-up. screen. So.
The ministry also is looking into that. Pero
All right. Well, thank you so much for stopping in. We appreciate it. And once again, to the women of Belize, just know that this is available. Instead of only finding out that you have abnormal cells, it is now possible for you to find out on the spot that you have abnormal cells and that you can treat them right then and there, which eliminates or reduces your chances of developing cervical cancer
By 65%.
by 65%, right? So
Yeah.
we want to thank you for sharing that information. We're going to go ahead now and take a break. When we come back, we'll be talking to a representative of NEMO about the latest with Tropical Storm Franklin, so stay tuned.